So first of all, let's define what a one-stop breast clinic is, or one-stop breast shop. It's a clinic that you are seen by the breast clinician or the surgeon, assessed clinically, and they take a full history from you. Then after that, you go and have your mammogram if you're above the age of 40, and you have an ultrasound scan. And if there is anything seen on the mammogram and ultrasound scan, a biopsy is taken on the day. Then you go back and see the breast surgeon, who will explain to you the results of the scans and will tell you what are the timescales to expect the biopsy results back. So it's the best diagnostic pathway for patients to come, be seen, have the results on the same day. But also when you're seen by a breast specialist, they don't only look at the complaint that you came with. They'll ask you about other things from your breast health point of view, might do a risk assessment on you, and give you advice on how frequently you need to be seen and scanned in the future. So if you have any concerns from the breast point of view, if you feel that there's something has changed, if you have a new lump, if there's change in the consistency of the breast, if you have new nipple discharge, skin changes, anything that's out of the usual, then you need to be checked. And that's when you need to be seen in a one-stop breast clinic, because when you're checked by the specialist, then you can have the imaging and you can have the peace of mind on the same visit. Most ladies that come to breast clinic, in the one-stop breast clinic, do not have breast cancer. More than 95% only have benign changes or some benign lumps there. But it's better to be safe rather than sorry. So if there is anything different in your breast, you need to be checked. In a one-stop breast clinic, it's not only the surgeon that you see is specialized in breast care, it's also the radiologists that's specializing in breast health, also the mammographers and the radiographers. But if you're one of the ones that are unlucky and have an abnormality or cancer diagnosis, you also have the support of the breast care nurses, and they'll be able to support you from the beginning of your journey to be able to get the best treatment. In the one-stop breast clinic, you'll see a specialist surgeon, radiologists, and radiographers. But after you have that diagnostic pathway and you know exactly what's happening, usually the surgeons will give you some information leaflets about what you have. So if it's breast pain, they'll give you leaflets about breast pain. If it's breast cysts or fibroadenomas, they'll give you something about that. But if you have breast cancer diagnosis, then they can give you some information about that once the diagnosis is confirmed. But you'll have the support of the breast care nurses that will be an extra support for you during this journey from the beginning of it.